What drew me to ophthalmology was the ability to impact a patient's life, improving their vision with a simple, elegant surgery that doesn't take too long, and it can have a lasting impact on the quality of life for the patient.
Cataract surgery overall is extremely safe, especially in the hands of experienced surgeons, and we do thousands per year. It's extremely rare to have a problem with cataract surgery. The vast majority of patients are very satisfied, high patient satisfaction, very low complication rates. It's probably one of the safest surgeries you can have.
Innovation is what drives eye care, giving our patients the iPhone 16 or 17 of eye care, giving the best outcomes for our patients, because a happy patient is a happy staff, is a happy doctor.
I like to think of the patients as a whole, not just their eyes. I'm also very much on top of patients like blood sugar control, diabetes, high blood pressure control, not only because it affects the eye, but again, because I think of the patient as a whole person. I think everything affects everything. But I do think I still learn a lot on a day-to-day basis.
Once you've had cataract surgery, you are not going to get another cataract. So it's pretty cool because it's one of the few things where we can actually cure a problem. Typically between 5 and 10 minutes. Not a painful procedure. It's extremely successful in giving you the best vision possible and potentially not having to wear glasses or contacts.
A monofocal lens, which is a basic lens that can make your distance vision typically improved. And then there's also a lens called a toric lens that can fix the astigmatism or the irregular shape of the cornea. There are also options called multifocal lenses, which can do different focal points, such as distance and near, to give you improved vision without needing to rely on reading glasses or glasses for computers.
Even if you started wearing glasses when you were in second grade, we can actually put a new lens in your eye that can make it so that you no longer have to wear those thick glasses. I have a lot of patients in their post-ops visits who say, I still wake up in the morning and the first thing I do is reach on my bedside table for my glasses, but I just realize I'm not wearing them and I don't need them.
PanOptix Pro trifocal lens is designed to give you distance vision, intermediate vision, and near vision. They're powerful. They get you that maximum range of vision, the most amount of glasses reduction we can offer. Aberrations of light, as we call them, or artifacts of light, are reduced between 5 and 10% with the new PanOptix Pro lens.
A light adjustable lens. It allows us to give you more of a blended vision, so it gives you that multifocal effect without having the side effects of the halo and the glare. We actually can change the shape of the lens using a light.
It's combining cataract surgery with glaucoma surgeries. In recent years, there's been a lot of updates to cataract surgery combined with what's called MIGS, or minimally invasive glaucoma surgeries. Only a few minutes, low risk. The safety profile is great. They may give some help in pressure reduction after your cataract surgery.
High blood pressure, diabetes, which is extremely prevalent in our population. Having things like an OCT, a visual field, fundus camera, being able to visualize the back of the eye is extremely important. Because a lot of times when we have conditions that will affect the back of the eye, they need to be treated quickly. The risk is much higher. When you're prone to certain conditions that will affect the retina, because the risk is so high, it's very convenient and it's very important to be able to have better technology and be able to see what we need to see in order to help the patient.
A cataract is a clouding of the lens in your eye. Everybody's born with a lens that focuses light to the back of the eye so you get a clear picture of the world. Over time, this lens can cloud and make your vision blurry. You can have glare issues, contrast sensitivity issues, even sometimes doubling of vision.
Mi nombre es Susela Oropesa. Yo soy oftalmóloga en Refocus Eye Health. Yo trato muchos tipos de problemas de ojos, incluyendo exámenes anuales, o cataratas, o glaucoma, o degeneración de la mácula.
Recovery is fairly quick after cataract surgery. Most people are seeing much better within 24, 48 hours. Patients are extremely happy after cataract surgery. A lot of patients notice that their vision is extremely better, as well as more light is getting into their eyes. Things are brighter. They're able to see more detail and more clarity after cataract surgery. It's extremely rewarding and gratifying, not only for the patient, but also the surgeon as well.
It was a very strong symbiotic relationship, and we have now found a year and a half later, for the most part, things have gone great, but it's gone really well. We worked terrifically well with our manager, who sort of helps manage all of our managers in the consortium. And our patients have felt nothing more than what they always desired in our practices. Doctors, staff, teams really taking care of their needs day to day. So the ability for physicians to be autonomous, to do what they do best historically, that has not changed whatsoever. And that's exactly why we did this deal with a company like Refocus. They have not micromanaged. They have not macro-managed. They've helped out with some of the HR parts of running a practice and some of the mundane parts that otherwise we did not enjoy. Some of us did, some of us did not. So it's been relatively seamless and it's gone well. And now we're into year 2 and we're hoping to get stronger and better together as we continue to feel each other out and what we want to do aspirationally to help other practices grow and to help other practices that are outside of our platform join our platform. Because guess what? You have the ability to be stronger together as a group. And we truly, truly believe that.
Cataract surgery is a once per eye, per lifetime thing. And once you remove a cataract, it never comes back. When we do your cataract surgery, we can refocus your eyes to be more in focus without glasses. That's a real advantage for people, and once they hear that, they get more excited about it.
We're still in the process of actively expanding, looking for quality practices. That is certainly the common denominator of any of the practices that we're partnering with. But I think in terms of really being committed to the future, being committed to the technology, investing in the equipment, investing in the right kind of folks that are going to be collaborative, that's really still at the forefront of our field. And we're continually evolving. There is the need to really have that focus on keeping up with the technology and just making that patient experience superb. When we joined them back in 2018, we were 2 ophthalmologists at that point in time. And so now we've got over 150 optoms and ophthalmologists, over 70 or 80 different practices. So it's been really gratifying.